Good evening, everyone. Today I'm going to speak about an interesting case, a pill provoked optic neuritis. Myself, Dr. Sharanyaa, KRISHNAMOORTHY, hailing from Pondicherry. A 22-year-old female presented with the chief complaints of progressive painless diminution of vision in the right eye for the past 2 days following a single dose of oral progesterone, 200 milligrams, taken for the infertility treatment. On the first day of the examination, the vision in the right eye was 2/60 and she couldn't read any color vision. Her anterior segments were normal, whether in pupil the patient had grade 2 relative afferent pupillary defect, whereas the left eye is with a normal limit. On fundus examination, the right eye showed the media was clear, the disc, the margins are elevated and the disc is hyperemic except in 1 clock hour. The AV ratio was 2:3 and the bright foveal reflex was present, whereas left eye is with a normal limit. On fundus examination, we can see the margins are elevated in except 9 o'clock. So we took a OCT RNFL where there is a thickening of the neuroretinal rim. So we diagnosed the patient as a dry eye drug-induced optic neuritis, and we gave the patient on 3 doses of IV methylprednisolone, 1 gram, and then oral methylprednisolone 1 mg per kg body weight for 11 days, and calcium was given for the patient for 1 month. So first day, the patient vision was 2/60 with the elevated disc margins, whereas during the second dose, the vision improved to 660 with pinhole 612. Still, the grade 2 RAPD was present, and there was hyperemic disc with elevated disc margins except 4 clock hours. Whereas while giving the third dose, the vision was 618 with pinhole 69, and hyperemia of the disc was decreased. We compared this with the OCT RNFL of day 1, day 2, day 3. When we compare all the 3 days, the first day there was increased thickening in the in the neuroretinal rim. As the third dose, it came within the normal limit. At the last review, the patient vision was 618 with pinhole 66, and the pupil was normal reacting to light. The disc was normal in color with the cup disc ratio of CDR 0.2. And this was the day 1 of picture of fundus and the last final review. This is the OCT RNFL, whereas first day there was thickening of the neuroretinal rim, whereas it became into a normal limit in the final review. So my conclusion is the progesterone is a widely used hormone by the gynecologists. Though it is rare, it can be a cause threatening for optic neuritis. Hence, physicians should be aware of this unusual presentation. I think the probable mechanism is progesterone is has immunomodulatory effect, which can sometimes be pro-inflammatory rather than an anti-inflammatory. So the progesterone also has an effect on the endothelial cells of the vessels. So it increases the permeability, affecting the tight junctions of the endothelial cells. Apart from that, it can also lead a fluid leakage from the capillaries. It would have caused the disc edema and inflammation. Thank you. It was normal, sir, actually. Oh, I didn't put the other eye, but other eye was normal. Was normal, sir.
So what do you think would have happened if you decided not to give steroids at all? What's the outcome of these sort of optic neuritis? So we know that it's most likely fluid or inflammation, not demyelination in these two cells, right?
Yes, sir.
What do you think would have happened? I've also seen similar patients like you.
Okay. It would have gone for an optic neuropathy, sir, maybe. The disc failure would have happened for the patient.
Yeah, so basically what happens is, this is, in these conditions, over time it does tend to resolve on its own, but unlike the typical demyelinating neuritis which would resolve without much damage, these would end up with a certain amount of damage, which is either because of the compartment syndrome kind of a picture that will develop, because this is actually edema.
Okay.
This is not really, it's not so much neuritis as it is edema that develops after a slight amount of
inflammation. But there is a drop in vision for, which is just a... yes.
The damage is because of that.
Yes, sir.
Even the other eye would have actually, some of the disc is not here, but if you looked at it probably carefully, you would get a subtle kind of margin change, which may not have gotten into that.
Maybe because we took the OCT RNFL also. Maybe I didn't put even in the OCT RNFL, there is no thickening at all. There is no inflammation. I couldn't see inflammation. Yes.
As Dr. Digvijay said, there is a mechanical element to it. But in addition to just OCT RNFL, you can also see the OCT macular GCC, because that also starts getting compromised. In addition to the RNFL value per se, looking at the cup volume would also add information as you see. I just have one question, that why did you give oral steroids for 11 days? Like, how did we land up to 11 days as a number? It's like abruptly, I mean, how did you taper?
We have tapered like every 3 days once because the vision got improved well in the third or fourth day.
That is not the correct protocol to decide on your own whether you are tapering in 3 days or 5 days. So the taper has to be like, you know, proper
ONTT.
fashion.
Okay. Okay.
But this doesn't really fall into ONTT in terms of the kind
Yeah,
of
but
optic
still,
neuritis.
Yes.
like 3 days is like a system,
Uh,
yes.
in ONTT trial, they have given like 3
This
days
is
of
not optic neuritis per
pers-
se,
uh,
as we would, you
yeah.
know, but even if it's drug-induced and you're treating on the lines of optic neuritis, like 3 days and 11 days, like it's a very random figure to, because just observing the improvement in the vision and abruptly stopping the drug when the patient lands up on 6/6 is not
No,
like
no.
the right
This
way
is
to
the
do.
ONTT protocol.
No, that is the ONTT protocol, no, ma'am. 3 days of IV methylprednisolone followed by 11 days of.
Yeah, but you see, it does not. That's what I'm saying. It's not befitting the ONTT protocol. So now, I'm not offhand remembering the study, but for the drug-induced these things, they are trying to, till the time the drug is cleared off your system, they're trying to give the oral steroids a little slower taper than you know what we would do for an.
Even after the edema is resolved, even the vision is
Yes, because
okay.
there is still subclinical edema, and that's why I said OCT macular GCC
See,
would have sort of added on to more.
We took
information.
normal OCT macula, but I didn't do the
The
GC.
MAC
Right,
GCC
see,
would.
Keep the other eye pictures.
yeah, sure,
Yes.
sir. Thank you. Thank you, sir.